mind you, all this treatment is being at home. There's a drug called enoxaparin, which is a low molecular weight heparin. It's a lifesaver. If your oxygen readings are below 95, 93, 90, 89, 85, 60, the lowest I've taken somebody back from 60 to 96 in the same day. I've taken somebody. I've also taken somebody with a severity score 2 weeks ago, 23 by 25, couldn't get a bed, told him to go home with his wife. His wife had this problem. Same day, we got a bed for him in the evening. I said, check your CT scan again. I'd given her 3 doses in less than 24 hours. The score was 16 by 25. Somehow the other, that clot that was evolving, that was happening, got dissolved. I took her home. In 4 days later, she had hit 99 on the oxygen reading. So you have to be aggressive. This is a clotting disease. Your doctors have to get more aggressive to treat clotting. This is not a viral disease, not a pneumonia, the old-fashioned pneumonia. I get all questions. Sir, पिछले समय हम लोग नींबू पानी नहीं पी सकते थे, कर्ड दही नहीं खा सकते, अभी सब खाओ, सब पियो, कुछ नहीं होने वाला. This is a blood clotting disease. The blood clotting disease is a very different behavior, very different thing to worry about. Okay. Steam. Let's talk about steam. Steam is very helpful when you have acute COVID. It's very helpful, especially if you want to, if your company mandates that you get a negative RT-PCR test. It's also helpful to clean up your nose and throat of any live virus if you've not had ivermectin. If you had ivermectin, you don't have to worry about it. I like to do steam. I tell people don't overdo steam. People go out every day and come home and want to do steaming twice a day. They're ending up damaging their nose and their throat by doing steam inhalation. So please don't overdo it. Okay? How can I'm sorry, I lost my thing. Let me go back and put on guys.
A number of questions which are coming are also more specific to their scenario. And maybe I would recommend if there is a way that they can reach out to you. Those details at the end of the session would also help. I think they're already about 10 minutes over. Maybe one question from the audience, if there is something, a live question would be useful.
I have one question I want to answer. Somebody has said they have a family member with a 17 or 18 by 25, and how can we reach out to you? You can reach out to me. You can either put, you want, I can, Ashish, you can put my number online for them, or you can just Google my name. You'll find out who I am. You can come to me. I will treat your family member to clean up the lung. I want the lungs pristine. I really want your lungs pristine, clean. And I've had great success cleaning up lungs that have been damaged with clotting. Okay, 15 by 25, 23 by 25. I had some great success. Your lungs must be clean. I don't care what age you are. Even a 70-year-old wants to be able to breathe properly, walk carefully, run around a little bit. Okay, I do not want your lungs to be damaged. Okay, what else?
Yeah, Ashish, I had a
can I ask a question?
Yeah,
absolutely. Maybe we'll go with Rajesh and then come to Abhishek.
Yeah, I had a question. Since you asked for a live question, basically, can one manage at home even a serious disease by a concentrator and the proper treatment through the doctor?
I'll give you stories. I'll give you stories by real life experience. There was a stage in Delhi, in the greater Delhi area, and Ashish and I have lived this very closely, where every day I got 10 to 12 patients, 10 to 11 to 12 patients, every night after 9 p.m. They couldn't get a bed. They could get oxygen. Patients' SpO2 oxygen saturation ratio had dropped to 69, 79, 71, 81, 89. And I managed those patients. Many times I'd stay up till 3 o'clock, 4 o'clock in the morning to look after those patients, stabilize them, and go to sleep. Okay. In 4 days, I had 40 odd patients. Guess how many I admitted? 1. Why? Because the lady could not get a refill the next day for her oxygen cylinder. How many deaths? 0. How many admissions? 0. Okay. So yes, it can be done. I've had the same experience in Bangalore and Chennai. When there are no beds, that's the best time for me to show what I can do. Okay. When there are beds, I know the family members will force you to go into hospital and you're at the risk of the hospital. And there are no beds, and people come to me. We do deliver on what we need to do. Okay? It's all doable, Rajesh.
Thanks. Hi, Doc. This is Abhik here, and thank you so very much for all the help we've got from you. And I know we're doing this, I think, day after tomorrow with the organization that I'm involved with. The question I had is, I'm dealing with a sort of a family, a person who lives out in the village whose mother is in the hospital. The lungs are affected. If one increase the sort of blood thinner and sort of reduce, would you see the faster recovery? Because what that person is having is, as long as the oxygen is there, she's fine. The moment she's off the oxygen or walking for 2 minutes, so will the enhancement of blood thinners in a situation like this, in a hospital situation, actually help the lungs recover faster?
Abhik, I've done this. Abhik, good evening to you once again, and welcome here. You and I have got a session on Tuesday.
And thank you so much for all the help you've given us with everybody in the family and extended families.
Regarding this specific incident, I can only give you, I gave you the history about the ones in Delhi and give you the ones in Chennai. It can be done. You need, people, I get doctors tell me, oh, I'm worried about bleeding. Damn it, you're clotting and you're worried about bleeding. We're having a thunderstorm or a cyclone here or flooding here, and you're worried about drought. Two different mindsets. Okay? The doctor has to learn to tackle the elephant in the room immediately. If clotting is one thing, they need to really go after that. Now, the solution for something like this is take that patient to a step-down unit, to a nursing home where they get the oxygen, and I can help you treat that patient appropriately in the hospital as long as whoever is the doctor can follow instructions. Okay? Lungs can be cleaned up. You get 3 months to clean up your lungs. If you don't clean up the lungs in 3 months, there's a chance you could have lung fibrosis. Lung fibrosis is like cementing, and once cement is set, you can't change that. We don't want to have lung fibrosis. So cleaning up the lungs is very important in clotting. Okay? And fortunately, I've had great success cleaning up the lungs. Okay? Where I have a documented baseline, and then post 1 month, I can have a documented baseline. And it takes sometimes 2 or 3 months to clean up the lung, but it's all doable.
I'll pick this up with you, Doctor.
You and I'll talk offline. Yeah. Thanks, Abhi.
Thanks, Doc.
Doc, I think we've pretty much come towards the end of the session. Thank you very much for taking this time out. I'm sure there are a number of other questions which have not been answered as yet. But for all the participants, I've shared the number, Dr. DeMello's number. So feel free to reach out to the doctor. He's very, very approachable. I don't know how does he manage to be approachable the way he does. I think the inspiration of this entire conversation also came because I reached out to Dr. DeMello more as a family member of a patient. We went through that cycle for a couple of weeks and really realized what it means to have the right understanding and what it means to have the right sort of guidance to pass through this. Because I mean, we've had enough number of information through WhatsApp University and a lot of doctors suggesting us a lot of other things as well. But it's been a great session, Doc. Like always, thank you for all your storytelling and all your guidance. And we're trying to also get this recorded and perhaps put across as a recording as well. But thank you once again. Thanks to all who joined the call. It's been a great 1 hour, maybe 20 minutes, 15 minutes, but I think it was worth the while and everyone would accept that. Thank you very much. Thanks, everyone. Feel free to reach out to Doc. Thank you, Doc.
Ashish, thanks so much for organizing it, and to everyone who attended it, it's been a pleasure to have you on. If you have questions, you know how to reach me. Most of you know how to reach me, and it's very easy to reach me. I'll try and answer questions. I'm pretty much snowed under at the moment. The workload has been phenomenal, and it's a lot of hard work to do. I probably get 5 hours of sleep a night, maybe 6 hours of sleep, and but that's life. It's a real humbling. Dealing with COVID is a very humbling experience. If I get arrogant with any patient thinking I know it all, the next patient will humble me. So this disease me humble and accept things the way they are and to how to treat them. So just as a